The post-op after 12 hours with stable vitals, controlled pain, and your client is tolerating diet. So this is not your priority. Your priority is post-op less than 12 hours with acute pain, more drainage, unstable vital, sign of bleeding. So this is always your first priority. Then this one, local and regional anesthesia is considered as stable, rather than general anesthesia is considered as unstable, because with the general anesthesia there are chances for respiratory distress. So general anesthesia beats local and regional anesthesia. Then mild lab abnormality. For example, you have a client with potassium 3.4 with no sign and symptom, no ECG changes, and severe lab abnormality. For example, your client is having potassium 6.5 and client has ECG changes, peak T. Then your client, you need to see this client first. Then your client ready for discharge, that means your client is stable. So you give the education to the client, you ready the client for discharge. Not ready for discharge, that means your client is in still critical condition that you need to keep the client in the hospital, you need constant observation. So this client is considered as unstable. Then typical expected symptom. For example, you have a client with congestive heart failure and your client has ankle edema, client is on diuretics, and there is no sign of shortness of breath, lung sounds clear. So that means client is having expected symptom of heart failure. On the other hand, you have unexpected symptom that is unstable. For example, you have a client with heart failure, your client is having severe edema, and you assess the lung sounds and there are crackles. You had the coarse crackles, that means your client is having pulmonary edema, pulmonary congestion. So that means the client with heart failure is experiencing some unexpected sign and symptoms, some complications of heart failure. So you need to assess that client first. So this is one of the most important thing. So कभी भी तुम एग्जाम कोई क्वेश्चन होता, so first thing that you need to assess, either this client is having typical symptoms or client is having new symptoms. New symptoms, new diagnosis, newly admitted are always considered as unstable, because you need to assess and you need to treat unexpected symptoms. You assess the client for complications. So always remember, stable means expected, client is improving, and chronic condition. So unstable is always unexpected, acute, and client's condition is deteriorating, that means your client is unstable. So always think, don't prioritize by severity, always prioritize by unexpected versus expected, prioritize by acute versus chronic. If you keep all these things in mind, you will never miss to choose the best option. So this is all about today's topic. We'll see you next video with next topic.